A very good evening to all of you. Today we have with us Dr. Rita Chauhan, Assistant Regional Director, Regional Service Division Indira Gandhi National Open University, to talk on public health and sanitation. She is also coordinating one of our course, the same course in MOOCs. I know you must have looked into those her about on her brief CV, which I shared through our discussion forum. In brief, Dr. Chauhan, after completion of her master's in environmental biology from University of Delhi, and she was trained under renowned ecologists of India, like Professor Shyar Babu. Then she moved to Jawaharlal Nehru University as an MPhil student and trained by one of the world famous limnologists, Professor Briz Gopal, and did her PhD also under him with another co-guide, Professor, I forget his name. Yeah. We did from that is School of Environment Science, IGNOU. Then, after that, she has worked in different ministry, and her work of her interest was on whether ecology and sustainable development. And now she is shifting to environment and education, and also working in this area of sustainable science with our IGNOU team in developing this discipline, sustainable science. With this brief introduction, I invite Dr. Rita to start the session. Thank you.
Yeah, thank you, Dr. Sharad, for brief introduction, and very good evening to all. Today, we shall be discussing about public health and sanitation. It is one of the unit under the block 1 of strategies for sustainable development, and of course for our course strategies and model for sustainability, MSD 016. Very briefly, we will understand what is public health and sanitation, and how the health and sanitation is related to each other, and how collectively it is going to affect all of us in present generation as well as in future generation too. So let us understand what is health. According to World Health Organization, health is a state of a complete physical, mental, and social well-being. We often say that absence of disease is not a health. We cannot say that if a person is diseased, so it is unhealthy. Many times, if there is no disease, then also he or she is unhealthy. Why? Because there are various factors which are influencing the health, such as the social well-being is very important. How is the relation with the society, with the people? What is the mental state of mental health? Then physical is like our health status, our body structure. So it's in totality of a physical, mental, and social well-being. And now the component of happiness is also included in this health. You must have known this happiness index is being carried out for the various countries. So happiness is also one of the important things to maintain a good health. And health is not only necessary, it is right for every person. It is fundamental right, irrespective of the race, religion, political belief, economic, or whatever the social background to which a people belongs. It is a fundamental right for every human being. So very much important is health for total well-being of a person. Whenever we look into the child, the healthy development of child is equally important. Their ability to live in total environment is essential for overall development of health. When a child is born, so he must get a proper condition so that he can grow properly, nourish properly. So it is duty of each one of us that when a child is born to a individual, he should be given all the necessary conditions for which he can grow into a healthy individual. So now we can see what is the sustainable health, how we can achieve a sustainable health, because we are learning health in the perspective of sustainability. We should have a high quality care and improved public health so that we can optimize the use, optimize our usage of natural resources without causing damage to our ecological condition. Because we are not for today, we have to look into for the future generation also. There are many challenges for protecting and improving health. We have to build a consensus among socio-economic and environmental development model. We need to maximize the health benefits, and also we should minimize the health cost. I mean the cost which is involved in maintaining a good health. So sustainable health is a move towards a personal commitment to maintain a responsibility for own health through a preventive measures. When we look into preventive measures, it will ultimately lead to the sustainable health. Sustainable health can be achieved through preventive measures, and preventive measures can be a individual or at a population level. There's a famous Rose theorem which states that a large number of people at small risk may give rise to more cases of diseases than a small number who are a high risk. So we have to give priority to those large number of people who are at small risk. And this can be done through a preventive medicine measures. We have already known that many of the diseases like polio, malaria, dengue, viral fever, these are all tackled by the preventive medicine. And now in present situation, our COVID situation is also COVID-19 virus. We have to take vaccines, which is again a preventive medicine for this present global crisis. So it's a preventive medicine is a medical disciplines which focus on preventing a diseases and promoting a general state of health and well-being. So it's just like a precautionary approach. How well we are, we have to take a preventive measures towards a disease. We have to prevent illness or injury. At many countries, preventive measure is a public health methods, and it can be done at the population and individual health level. Like you must have seen many hospitals, they are offering a preventive care for a particular age group, like beyond senior citizen. You can take a preventive health care, or up to a certain age limit, you can do this. This is a new practice in India, but in Western countries, it has already been there. In India, we consider more at a individual level. So preventive care, what is preventive care? We have to look into this, like how we can prevent our disease to occur in us, which can be done through various examination screening test. Like we can go for many of the blood test, urine test, any of the physiological or any of the clinical test. We can do it to make a state of our health. What is the state of our current health? We can know it. It is not necessary that when we are ill or when we are a diseased person, only then we have to go for a test examination. We can also, if we feel healthy, in many countries there is a compulsory 6-month preventive care measures taken for all the individuals. We must slowly, many of the corporate sector in our India also, they are investing more on the health of an individual. So they are going for preventive measures. Preventive measures, when we look into a public health point of view, it involves many measures also to prevent the spread of disease. Like we have to look into what are the mosquito or pest or insect control. If we control insect or vector-borne vectors, then many of these vector-borne disease can be controlled. We have to carry out vaccination drives, like presently we are doing for COVID situation. We have to look also into what are the safety measures for food storage, food processing, and of course, hygiene is primary thing of all. We will discuss more of this in our later session also. So again, just I am reiterating the things. In developed country, they have include the things preventive health as a public health, while in our country, in eastern part, we are looking into more of a individual health. When we consider preventive health as a public health at a larger population, we need to have extensive research and development, because for this government is considering, in western part government is considering that preventive health is important for each one of us, for the whole population. So they will do extensive research and development. Then they will also monitor the food supplies, and they will also regularly check whether there is any epidemic disease going to spread or not. Such kind of preliminary studies are being done. Whereas in countries like eastern part, including India, we are concentrating preventive health more as an individual level by improving the hygiene or living condition to prevent the outbreak, to have vaccination and educating the population. Again, when we are considering the preventive measures at individual level, we will consider the body as a whole rather than individual part of body. So our focus will be to make an individual health important. So for this, body will be considered to be happy, healthy at individual level. Whereas when we look preventive measures at population level, we have to look into at a society point of view, at a group of people, at a population level. What is the psychological problems people are facing? What are the sociological challenges people are facing? What are the economic conditions people are undergoing, which can cause unhealthiness in a person? So the motive there will be to make entire population a disease-free and healthy. So whenever we take preventive measures, preventive medicine, both at individual level as well as at population level. Only then we can solve this health system in an effective manner, that is in sustainable manner. So we have to progress more towards incorporating preventive medicine at population as well as at individual level. Whenever we are looking for a healthcare system, it is not one sector thing. We need a hybridization between various sectors. Like just we mentioned, for preventive measures, we need to have extensive physiological examination. So we need to have clinical laboratories, medical practitioners, then we should have medical research laboratory, then we should have research and development organization which can carry out new drugs and discoveries for the new diseases. Then we should also look into collaboration between preventive medicine sectors and then also the health insurance. Health insurance and life insurance, both we need to consider as a collective. Only then we can achieve a collaborative and constructive partnership so that we can achieve a good public health system. Further, it is not necessary that a country can achieve the best of the status, medical facility status. Like you must have seen, even India is having a lot of medical tourism. Many persons from the Indonesia and Saudi Arabia, they are coming to India for a medical treatment. Why? Because India is offering good quality healthcare system and at an affordable price. So many people are coming for surgeries in India. So when we look at a global level, we need to come across a collaboration between all kind of countries, which including a low income country, middle income country, and high income countries. And this is not only for the facility. We should also look into the cross-sector approach for the research and collaboration also. Like you must have seen, when we are working for this COVID-19 vaccine, different countries they have given this vaccines of their own laboratory, and now India is much ahead that it was exporting to the nearby country also. So this kind of approach is very much required for a global health. And all this is coming under our Ministry of Health and Family Welfare. This, our ministry is both now doing for a public sector also and private sector also. We shall be discussing more in coming lectures also for this. Now we come to the sanitation part, because here we are going to relate our health with sanitation. What is a sanitation? In layman term, we can say, like, we all are now using a sanitizer. So often it's a measure to make us a clean or hygiene, while sanitation is a term which came into a 19th century, and it was for a sewer management system. It was an English term which was introduced in 19th century for integrated water and sewer system. Sanitation is a hygienic method of promoting a sustainable health through prevention of human contact with hazards of the waste which are generated by human or human activities. The waste can be of physical nature, microbiological, biological, or chemical agents of disease. And there are many human activities which are causing disease to our health also. Some of the waste which are causing directly health problems are the human and animal feces, the solid waste which we are generating from our household and industrial purpose, then domestic wastewater, our sewage, sewage, grey water, then industrial waste. We also generate the agricultural waste. All of these are creating a health problem. So it is a need of our to manage this waste very effectively so that we can have a sustainable sanitation. According to World Health Organization, sanitation refers to a provision of facilities and services for safe disposal of human waste and feces. So World Health Organization have very much emphasized on we have to improve the facility and services. We can dispose of the waste very effectively so that it does not cause harm to human health as well as to our environment. In other terms, we can also say sanitation is a maintenance of a hygienic condition because we maintain a hygiene condition through a lot of service related things, like if we do a proper garbage collection, we properly dispose of the wastewater, then automatically we will properly manage our waste. Whenever there is inadequate sanitation, it has caused a lot of problem to the disease worldwide, specifically diarrheal disease, jaundice diseases. These are all diseases which are directly related to the improper waste management. And these waste are mainly created by the human activity. So it is our important part that we should manage it properly through a proper facilities and services. Sanitation is basic as well as a long-standing public health issue. So we have to look into this. Sanitation was very early in Minoan civilization. People have known that how much important is sanitation for our health. So in 3200 to 1100 BC itself, sanitation was considered as a very important thing. This is the period of a Bronze Age, and at that age, they have already developed a very advanced wastewater and stormwater management system using stone and terracotta, which can easily drain the stormwater and wastewater. So this civilization has already developed a very good sewerage and drainage system. And in our part, Harappa and Mohenjo-daro and Lothal, it was, you must have read at many places that it has a very well-developed urban sanitation facilities. So at that point of time also, they have known the importance of sanitation. They know that how to effectively manage the wastewater, which is coming through usage of human or stormwater or rainwater, and also the human excreta, how to effectively manage it so that it doesn't cause harm to each one of the people. Even they have a centralized as well as a decentralized approach for a sewer system. Sewage system was a network of drains that they have used a baked brick running along the street. Even they have developed a floor also. Like if a people is living in a second floor, they also have a bathroom with the terracotta piping and vents. So you can easily know how people at that time also they were so particular about the sanitation. Sanitation term can be applied to a specific aspect, concept, location, or strategy. In very basic format, we can say it is management of human faces at household level. Simply, if we manage our human waste, our human faces at household level, then it is a sanitation. However, when we look into a site-wise, then it is a collection and treatment of waste from an area. Like when we are in colony, so we used to have, we used to look into the pit latrines, septic tank should be there, and in-house tank should be there. So it will be a on-site sanitation. When we look into the food sanitation, it is basically a hygienic measures for ensuring a food safety. Similarly, when we look into our environmental point of view, we have to look into sanitation in the view that we have to control the environmental factors that, that are linked to the disease transmission, such as we have to do a proper management of solid waste management, then wastewater treatment, industrial waste treatment, treatment of noise and pollution control, so that it does not cause harm to our environment. In similar fashion, when we say ecological sanitation, it's the totality of the thing. When we say ecological sanitation, it's a concept and approach for recycling. We have to look for a recycling of resources from human and animal waste. We will learn about this resource recovery in our few minutes also. Ecological sanitation is presented as a radical alternative to conventional sanitation system. It is based on like what we are doing, a composting and vermicomposting toilets, where an extra separation of urine and feces are there at the source. So when we are saying ecologically, we are looking into a different perspective. We are not only managing the waste, we are also looking it as a resource point of view, how we can do a resource recovery. For example, from agriculture waste or from human waste, how we can have manures, agriculture, how we can have a vermicomposting, how we can use earthworm, how we can use this plant litter fall to a manure form. So these are all we will understand in short while. Let us look into the what is the status of a health and sanitation at global level. According to the WHO and UNICEF report of 2019, globally, 1 in 3 people, that is 2.2 people, still lack access of a safely managed drinking water system, and 4.2 billion people, they lack safely managed sanitation services. So we are very far behind our achieving the targets. The impact of child mortality rate is devastating, with more than 297,000 children under the age of 5, which we call as an infant, they die annually because of diarrheal diseases. And these diarrheal diseases are due to poor sanitation, poor hygienic condition, or improper or unsafe access to drinking water, to a pure drinking water. Open defecation is again one of the most prevalent thing which needs a take care. Though we have a lot of things in now. So now we come to what are the sustainable development goals, which is also called as a global goals, which are ensuring the universal access to water, ensuring the health, well-being, and achieving the access of adequate and equitable sanitation and hygiene for all. So our sustainable development goals of 2015, they have a target for ending the open defecation by 2030. And it will look into all the aspect of access to water, health, sanitation, and hygiene for all. And these goals are also paying a special attention towards women and health, women and girls, sorry, and even the person who are in vulnerable situations. So basically these sustainable development goals, they are more into a behavioral and infrastructure target for sanitation. Earlier people, they were not knowing they are not going to toilets or not because they feel that human waste are very it's not a very, it's an unhealthy thing. So they were not paying attention towards it. Suddenly, this has been globally recognized that why people are not going to toilets. Is it a behavior thing or is it a infrastructure related thing? So many studies have indicated that it is both of the thing. That's why this sustainable development goal have taken into consideration that we have to have a behavioral change as well as we have to develop proper infrastructure for the sanitation. Only then we can achieve a very good health for all the population. And this can be done to by converting the open defecation to a latrine use. You know our Swachh Bharat Abhiyan. We will be learning more about it in a few minutes. So open defecation and lack of safe sanitation, they are associated with the increased diarrheal and mortality and negative social impacts amongst the women and children. It is very important that we have to focus more on females, more on women, because children's at their young age, they are associated with the woman or mother, we can say. They are more towards them. So when we educate women, when we inform them to have a hygienic practices, it will ultimately percolate down to the future generation also. And it is already known that under the age of 5, and mostly in low income people, most of the death are only because of this diarrheal diseases. According to the joint monitoring program of water supply and sanitation, which is carried out by the World Health Organization and UNICEF, they have clearly defined what is the improved sources of drinking water or what is an improved sanitation. Does an access to our drinking water or sanitation is enough, or do we have a proper arrangement? We should have a proper arrangement for sustainable access for safe water and basic sanitation for all. For example, when we have a piped water into dwelling and a piped water to a yard or plot. Public tap or standpipe, tube well, bore well, protected dug well, protected spring or rain, proper management of rainwater. Only then we can have improved sources of drinking water. So our drinking water should be properly piped and protected from all the conditions so that it should maintain the good quality for drinking purpose. We cannot simply say that a bottled water is a unimproved is a good source of drinking water, or an unprotected dug well, it's a improved sources. We have to make sure that it should be well protected from any contamination. Similarly, when we look into a sewer or sanitation system, then we should have a proper system. Only then we can achieve a improved version. So these are the definitions given by WHO and UNICEF for a proper sanitation. And the joint monitoring program, they generally have these indicators to access what is the status of a country towards sustainable access of a safe water and basic sanitation. For improved sanitation, for example, we should have a flush toilet. We should have a piped sewer system, a septic tank, a well-ventilated, improved pit latrines. The pit latrine should have a slab. We should have a composting toilets. These are the indicators for a improved sanitation. We need to have a institutional arrangement so that we can have a better sanitation and hygiene condition. And it should start from the education institution to a health institution also. For example, when we are in school or colleges, from there also we have to teach the hygiene condition. When we are going to school, we should have a proper hygienic sessions, how to maintain a good health, how to have a good hygiene, so that we can prevent the spread of disease. We already know that in present situation, we are going towards more hygienic condition, proper sanitization of hands, then a regular hand washing at frequent interval with a proper soap, alcohol-based sanitizer. These are all practices to maintain or to prevent the spread of the viruses. So such kind of hygienic conditions should be informed student that whenever you are going to a washroom or latrine, you should wash your hands. So these will automatically prevent the spread of disease. Similarly, we should have a health camp by many health institutions to have a preventive work, to have like we have cholera, we have polio. To prevent the spread of these diseases, we should have come forward with a health institution. Similarly, for a food and biopharmaceutical industry, we should have a proper clean in place and sterilization procedures so that whatever waste is generated, we should have a clean waste so that when it is going out to the environment, it is not causing harm to our natural resources. And as far as possible, we should sterilize all the waste which are generated by this, especially with this biopharmaceutical industries, because they have whatever for a drug discovery, for R&D sector, or any of this biomedical waste. They carry a lot of pathogens, virus, bacteria, which can cause which when reached to the landfill site can cause problems to human health as well as to our nature, because ultimately it is going to affect our groundwater. So, so we have to look into the clean at place procedures for such kind of organization. Let us understand what is the situation of sanitation in India. According to a study by Asian Development Bank, ADB study, they have highlighted that we have to have a household sanitation, improved household sanitation and drainage system in India. The pro-poor sanitation program must be scaled, because we know most of the poor people, they are not taking care of their hygiene or sanitation due to poverty or many other reasons. So we should have a more towards them. We should have sanitation program exclusively for poor people. Then investment must be customized and targeted to those who need the most, such as the people who are at below poverty below poverty line. They must be given proper sanitation facility, because we cannot say that if we are having a good facility, so everyone is having a good facility. In a slum area also, if any people is having problem, then it is going to affect all of us. So we have to look into a totality of the system towards a whole population. Further, we have to look into cost effective options, a very appropriate low cost, because simply we cannot say that we can adopt a high cost management methods or treatment methods. For us, economic is also a very important point of view. Cost for proper management. We have to look into the proper planning and sequencing. Carefully planning should be ensured so that whatever investment we are doing should not be wasted or become redundant. The community-based solution must be adopted. We already have community-led total sanitation programs, which were very successful. We should have more of these things. And further, we should involve women as agents of change, because women is a center to a family as well as to a society. We should encourage more investment and innovative partnership, public private in this partnership. Then we should involve non-governmental part also and consumer also. So we should have an innovative public-private partnership to have a better sanitation systems. Let us understand what is community-led total sanitation. This community-led total sanitation was an approach which was being implemented in 2000. And in this year, it was started in Bangladesh and spread across the world also. Basically, community-led total sanitation, it's a participatory method at a rural level. It uses a participatory method in which the community people are involved for a practice of open defecation and promote latrine construction. It is not at the individual level. It is at village or a community level. They collectively decide how we can have a proper latrine construction so that all the people of that community can be facilitated, sorry. This approach brings a fundamental change from a focus from an individual or household sanitation to a community level. So it was a breakthrough from individual to we are coming to societal level. So in this method, what we do, it's a process called triggering. Triggering has a three-step process, which we call as a pre-triggering, triggering, and post-triggering. Pre-triggering involves we have to select a community, then we have to train some facilitators and collect the baseline information of that area, of that community, and coordinate the community entry. This is called pre-triggering. We select the community and we have to impart training to a facilitator. We have to identify some people in the community which can act as a facilitator. Then second step is triggering. In triggering, we organize a community-wide meeting. The person who are selected as a facilitator, they will use a participatory exercises and train to all of the people in the community. Basically, it's to bring a behavior change for disgust or shame, because we know many people are not using latrines because they consider it as it's not a good thing. So we need to have a behavior change, which was done by these community facilitators. Then post-triggering involves following up of a routine visit, because it is not the thing that once we have started, we have to routinely monitor it, whether this community-led total sanitation is achieving its goals or not, whether it is going to stop open defecation or not. So we need to have a regular visit so that it can maintain a good open defecation free status. So these triggered villages will be followed by facilitators who will go and judge whether that area has become open defecation free or not. Based on the status, they will be given certificate. Like we have Sikkim, which has given this certificate, and many other states also. So this was introduced in Bangladesh in 2000 and with the help of international NGO. These photographs show one of the example of a community-led total sanitation. In India, it was started in 2002 in Ahmednagar districts in Maharashtra. When it was introduced, only 16 out of the total 35 states, they have incorporated this community-led total sanitation. But now situation has improved. Sikkim has been declared as a open defecation free. And Himachal Pradesh is another state which has adopted a non-subsidy model with a community-owned agenda as a part of sustained campaign. And this community-led total sanitation is not only for a rural area, it has moved to some of the urban area also. Like it has been practiced in Kalyani districts in West Bengal, then Raigad near Mumbai in Maharashtra. These are some of the urban districts, urban areas where also this community-led total sanitation has been successfully launched. Let us understand a few more things about the rural sanitation. rural sanitation was initiated in 1986 through a central rural sanitation program, which is called CRSP. Then in 1999, we have total sanitation campaign, which is also called it as a community-led total sanitation. Then in 2012, we have Nirmal Bharat Abhiyan. And now in 2014, we have Swachh Bharat Mission. Initially, this Clean India mission was mainly for Gramin area. And it was decided in 2014 that after by 2019, which is 150th birthday of Mahatma Gandhi, this Swachh Bharat mission at Gramin level, at rural level, will achieve its open defecation free status in 5 years. That is from 2014 to 5 years, all the rural area will be open defecation free. This Swachh Bharat mission Gramin is coordinated by Ministry of Drinking Water and Sanitation, and now it has moved to urban area also. So Swachh Bharat Mission is a flagship program and is the world's largest sanitation program, which has accelerated the universal access to sanitation in rural and urban health. So this Swachh Bharat Mission is one of the subset of our goals to achieving the Sustainable Development Goals. It was started in 2014 and now it has achieved a lot. For example, in 2015, India was only 60% open defecation free, and India was also far behind its neighboring country, such as Bangladesh, Sri Lanka, Pakistan, and Nepal. They were far ahead of India. But now, today, India is at better junction and improved junction with the data shows that 98% of sanitation has been covered. But still, we have only 71% of latrine ownership, and the coverage of sanitation is only 93% in rural India. We have yet to achieve its target. So the main thing of this Swachh Bharat mission is to terminate the fecal oral transmission of pathogens by preventing harmful germs from entering the human body. So this involves construction of toilets and also the use of the toilets. You must have heard in media also that at many places toilets are constructed, but people are still not using. So Swachh Bharat mission, they are doing more of promoting the use also and constructing also, because it's more of a behavior change. And also we have to improve the infrastructure also. The safe and sustainable sanitation technologies, inclusive of sanitation program, and it is very important to change the attitude and social norm of an individual. These are few of the constraints which we are facing. And still, in many of the rural area, the people are still infrastructure has been developed, but they are not changing the attitude. So we need to have a reform to use of the toilet. Swachh Bharat mission, they are promoting a twin leach pits, which is a low cost on site sanitation technology that not only effectively manage the sewage waste and also safely deals with the excreta. Many of the families, they have installed excreta contaminant structure that simply hold but do not treat. But now we are focusing more on the treatment part also. So from a collection to treatment of human waste generation is need of hour for the day. Besides it, it's very important to have a proper hygiene. It is not that waste generated is properly treated or managed. We have to maintain hygiene also. Many of these diseases can be stopped when we maintain a proper hygiene and ensure a proper availability of potable water supply. Hand hygiene in particular is very important and very cost effective. If a person is going to toilet and not washing a hand, he is subjected to many diseases. And especially children, if they don't wash their hand after using latrine or while playing also going doing any activity, the hand is the thing which is a important point of spread because children are using their hand, they are they are uh, they are using for many purpose and then they are putting their hands in their mouth and it is directly going to the human to their body. Even the women also, they have to take care that they should properly maintain a hand hygiene while they're preparing the food, when they are feeding the children. And it is very important that all of us should have a maintain hygiene before going for having the food. Because when our hand is clean, then automatically the food we are going to have will be clean. So some of the sanitation tip for a healthy environment could be that we should have a properly cover all the containers. We should maintain a hygiene condition in our home. Water containers should be washed properly, disinfectant on regular basis. Food should be preserved without contact of contaminated water or ground. We should have a preservation of meat and milk product. We should carefully look into it because whenever we are having a preserved preserved food items, we should look into it is properly preserved. We should just not go and buy the things. Whenever we are buying anything, we should look into the facility conditions under which it was stored at proper temperature. And we should avoid many of the cold things and always prefer for a cooked thing. Like we all know that we can prevent this flu like diseases if we cook the raw meat properly. All this bird flu, they can be prevented if we cook our meat properly at very high temperature. So these are some of the measures which we can take at our own level to maintain a healthy environment. Let us look into what are the sustainable sanitation, how we can achieve sustainable sanitation. Sustainable sanitation, these are the basic solutions that apart from protecting and promoting human health should be covered the three pillars of the sustainability. That is, it should be economically viable, socially acceptable, technologically, institutionally appropriate, and also protect our environment and natural resources. In other words, the sustainable sanitation must address the economic, social, technical, institutional, environment, and natural resource dimension in an integrated way. Only then we can achieve a sustainable sanitation. So it's not a single technology or a specific limited sanitation design, but rather an integrated approach, which include a broad set of criteria to have uh, to achieve a universal and equitable access of water sanitation services to all people. So basically, sanitation in urban development can have a social dimension, urban development, and cross-sectoral dimensions. We cannot say that it's a one sector related thing, sanitation, because it's a water supply drainage thing also. We have to look into solid waste management, housing. We have to look into the energy sector also, transport, green area management, agriculture sector also. So it's have a cross-sector approach. On another hand, it's also have a social dimensions, which equally have a participation of all social people. And we should have a awareness rising and capacity building in this field. We should have a cultural acceptance. We must look into the gender and equality consideration. We must have a ownership and affordability. Affordability is very important, and improved livelihood. These are the various social dimension we have to have for a sustainable sanitation. And when we look into a urban development point of view, there we should have a public health, natural resource management, land use management, poverty reduction, business and empowerment. You must have learned about these dimensions at various levels. So basically, sustainable sanitation must be centrally located. It must be integrated with the with all the sectors of social urban development and all the sectors dimensions. Do we have a resource recovery from this? Yes, we have. Can we protect or can we recover the resource from these management perspectives? Can we make our resource, can we have a urban management as a resource efficient? These are some of the things we will learn in a few minutes. This is one of the conceptual overview of waste resources, resource content and potential for recovery. Whatever waste we are generating in the form of human excreta, detergent or food waste, animal manure, these all wastewater, industrial water, river water, can it be used? It can be used, or can it be reused? So various studies, they have shown that certain elements from these resources can be, some of the resources can be recovered and some of the part can be reused. So whatever the waste is generated, we have to properly manage it, that we have to look into whether we can have any resource which can be recovered from these waste. Can we form a minerals? Can we form a manure from the agriculture waste? Can we have a plant fertilizer? Can we use the organic matter as a soil conditioner? Like we use coir as a cocoa peat. This is one of the agriculture waste, and it is reused as a cocoa peat and one of the best thing for generating the seeds, for germination of seeds. So we have to focus more on the resource recovery or reusing the recovery from the waste which are generated. Further, can we use this as an energy perspective? Energy which can be in the form of a biofuel or in the gas, or can we have a heat from it? We will understand few of these things in next few minutes. This typical figures shows a sanitation waste system, this figure, and how we can achieve various reuses. Like we can have plant fertilizer, we can have soil conditioner, we can have protein feed, trace element. These are some of the valuable minerals which we can get from the waste. In fact, we can have ecological services also. Constructed wetland is one of the best example for that. You must have known the constructed wetland. It is used as one of the method to improve the wastewater treatment. And it offers one of the good ecosystem services. Improve the to improve the water supply to for wastewater treatment, like we can grow many of the wetlands and it can absorb the toxic elements and absorb the organic matter and make a clean water. These are the constructed wetlands. And we can we use water which are generated from these wastewater? Like, can we use this water for irrigation, for industrial, for potable purpose, for groundwater point of view? We can have all these options. Further, we can also look into the sustainable sanitation from a resource management point of view. What could be the resource which can be reused? Can we use it for energy generation for ecosystem purposes? And then can we use for a technical purpose also? What could be the technical system options which we can use so that we can properly manage our resources? Which technological options can be best, whether centralized or decentralized? Grey water management, sludge management, off-site or on-site treatment, wastewater treatment. These are all technical systems options can be explored for a proper resource management perspective. Some of the excellent example of resource recovery is that human excreta can be used as a fertilizer. And in one of the reuse option is that according to a study, I will leave this PPT will be available to you. So these I have extracted some of the good example of a resource recovery. Then there are a few case study also where the fecal sludge have been used for anaerobic digestion for generating biogas and also for diesel. These are some of the examples. So we have to look into a resource recovery option. These are some of the wastewater treatments, wastewater situation. These are again wastewater because how we can treat it, what are the potable and non-potable point of view. This is some of the example which is given by US EPA that how water has been used for direct or indirect potable as well as non-potable reuse form. Non-potable reuse form can be for irrigation purpose or for it's often injected into the aquifer for being reused. This is some of the project example. Then what is the risk and benefit of wastewater reuse? We have to look into an integrated method, whether what benefit we can get from a wastewater risk management. What are the risks we are facing? What are the wastewater pollution and water scarcity? We have to have a risk and benefit assessment. Only then we have to use that technology, whether it is going to benefit more or having a more risk. After this assessment only, we have to use such kind of any treatment methods or technologies. These are some of the reuse cases in India. Typical reuse applications which has been done in India are forestry. We are using for horticulture, fish culture, toilet flushing. Many of the wastewater which are generated are treated and they are used for these cases. India is very nascent in reuse policy, and slowly we are going towards it. Many of the industries also, they are having a zero liquid discharge regulation also. So we are slowly moving towards it for adopting these kind of technologies. These are some of the solid waste, like wastewater. We have to effectively manage our solid waste also and look into the option of all the resource recovery, reuse method, and safe disposal of solid waste is equally important. With proper management of waste in landfill or incineration wherever possible, then recycling of the waste, composting, or conversion to a biofuel. Few of the approaches to address the water sanitation or global health are prevention of contamination of water in distribution system. We have to look into the growing water scarcity and potential for what are the water reuses or conservation strategies. We need to have an innovative low-cost sanitation system. We have to look into what could be the sustainable water supplies or sanitation for urban and semi-urban areas. We need to reduce the disparity among various regions in our country and sustainability of water and sanitation services. Innovative approaches are required for low cost, simple, and locally acceptable water and sanitation interventions. And we need to integrate all these approaches to all the social institutions, whether it is at school level, whether it's at society level, in market area, in health facility. So we have to look into a totality of the system. So some of the action points for high quality health system. This was a study published in Lancet by Global Health Commission, which outlines some of the universal action point for high quality health system. We should have a shared vision of quality care, a clear quality strategy, strong regulation, and continuous learning. Only then we can have a good governance for total health management, for high quality health system. The countries should redesign the service delivery also so that it can maximize the health outcomes rather than geographical access to services alone. We have to look into the entire country and we have to ensure that services are delivered at all places across the country. We should transform our health workforce by adopting a competency-based clinical education. We should focus on training in ethics and respectful care and respect all the workers so that best possible healthcare is given to all. When we are visiting hospital, we need to have a good healthcare system from a nurse level to proper, from a ward boy to nurses to doctors. So we have to inculcate that training for respectful respectfulness care. Then government and civil society, they should bring together a good options for health financing, management, district level learnings, so that we can have a complementing effect to achieve this global effect for a good healthcare. We all know about the present scheme of Ayushman Bharat, which is having a universal coverage. It's a flagship program to have a universal access, equitable and affordable healthcare for all, with the creation of comprehensive primary healthcare services, and also the Pradhan Mantri Jan Arogya Yojana, which is providing financial protection to needy and poor people. Some of the sustainable development goals which we have covered. This is a summary of this. Wherever we can find the good health and sustainable sanitation, it can be seen through goal 6 of the sustainable development goals. And there is a synergies between the sustainable sanitation and other sustainable development goals. Like goal 6 is on clean water and sanitation. Then we have goal 5, which says gender equality. Then goal 2, which is zero hunger, which again involves this improve food security. Then goal 12, which is sustainable consumption and production, which ensures recovery and reusing of valuable resources present in the excreta and wastewater. Then goal 11, which is covering the sustainable society and communities. This is over all for the society, and it is not achievable without the adequate sanitation and wastewater management. Also, the goal 1, non-poverty, goal 8, which is decent work and economic growth goal. These all goals are having integrated approach for achieving a good health and sustainable sanitation. So these are the few references which has been used in our present presentations. So we can invite if there is any question we can take up.
Yes. Before that, as per our tradition, first, you close the, sharing screen
Yeah.
option. Then what we can do, uh, all are requested come on video so that we can have a photo session. This is our tradition. Please come on the video, please.